So, Damien, thanks for being with us this afternoon. We are happy to have you here as an industrial officer. You haven't been with us for long, but you were very much thrown in the deep end when you got here. And what we wanted to talk about today was the privatisation debate. It's been in the news a lot lately.
Yes.
And particularly about the hospitals as far as we're concerned. Do you want to tell us what the potential problems are with the privatisation of hospitals?
As far as our members are concerned, I think we have two real key issues. And the first is related to the training and education of our junior doctors. As you know, we've got one of the best hospital systems in the world, and the reason we have that is because our public health system allows our staff specialists, our senior doctors, to provide the training and supervision for our junior doctors.
Right.
If the hospitals are privatised, they may go with a contract doctor situation where they employ more VMOs. Now, there's no contractual obligation for those doctors to provide the same level of training and education for our junior doctors. So if that was to occur, we would see a decrease in the quality of our doctors, and that would have flow-on effects to the patient care. The second issue is obviously the conditions and entitlements for our doctors if they were to move into or transfer to a private hospital. Our experience is that with certain organisations, we've seen them try to cut costs by reducing the level of entitlements that our senior doctors are entitled to, such as the training, education and study leave. Recently in some of our bargaining for Chris O'Brien Lifehouse, we noted that they were trying to remove or reduce the access to that TESOL component. So that is a significant concern for our doctors if these hospitals were to be privatised.
Okay, all right. So it appears that there's a conglomerate of unions that are in on this. So which are the unions that we're particularly focused with?
Okay. So when this campaign started, we realised that the most important thing was safe patient care. At the end of it, it's really about the provision of safe patient care for these communities, and that means it doesn't just affect doctors, it affects the nurses and it affects the allied health staff.
Right.
So we got in contact with the HSU, the Nurses and Midwives Association, and also the peak body, which is Unions New South Wales. So we formed what we call a health coalition or a combined union to run a campaign really based on the notion of ensuring that our communities continue to receive the same level of patient care that they're entitled to.
Wonderful. Okay, so what hospitals have been affected mostly by the privatisation?
Okay, so on September 15 last year, the then Minister for Health, Gillian Skinner, announced by surprise that 5 hospitals were going to be up for privatisation, and that was Goulburn, Bowral, Wyong, Shellharbour, and to a certain extent Port Kembla with that, and Maitland. And that took us by surprise, it took our members by surprise, and it took the communities by surprise because there was no consultation undertaken to test the viability of whether privatising those hospitals would actually be of benefit to the community.
Right, okay. So during the course of the campaign, you obviously have seen some wins come out of this.
No, it's been great.
Yeah, so which particular hospitals have you focused on and that have brought about these wins?
Okay, so very early on, I'll list the 3 that the government has backflipped on, and that's very clearly Goulburn, Bowral and Wyong. Goulburn was the first to go, and I think really that is down to the immense pressure the unions put on the minister down there, which was Prue Goward, after realising that in 2 weeks we were able to mobilise and get a very strong campaign on the ground, and the government immediately put the brakes on and backflipped on Goulburn. With Bowral and Wyong, we see two reasons why they backflipped. With Bowral, there was a very strong community campaign that was started by the unions but run by the community, which was called Public Health First. And they were able to go through the clinical services plan, pick it apart and present that to Minister Hazzard. And immediately after realising that it wasn't viable and wasn't a benefit to the community, they backed down on that as well. With Wyong, that was a campaign run, again by the unions, and I think it was just down to the effort of the unions, train stations, street stalls, engaging with the community, massive rallies as well that we held across the state in each district, and Wyong, I think, had about over 2,000 people attending from the community, from the staff as well, showing their support that this wasn't a benefit for the community. And I think the government saw that it wasn't a benefit. And look, one of the anecdotes we had from the community forum that was held there is Scott McDonald, who is the MLC and one of the Liberals up there, came down and said, when asked the question why that they were pursuing this in Wyong, and his response was that, well, we're seeing that these models are working, particularly in Northern Beaches. David Harris was quick to remind him that Northern Beaches isn't even open. So it's hard for it to be a metric of success when there's no patience in there.
Right.
And I think he took that back, and once again the government backed down on Wyong as well.
Excellent. So congratulations on those enormous wins. They're fantastic for the communities especially. So now we have to focus on which hospitals?
Okay. So the two remaining hospitals are Maitland and Shellharbour. So Maitland, they took off the expressions of interest out for a private operator, and they've now put it on for a not-for-profit operator. That is still really concerning for us because it's not a Schedule 3 or an affiliated health organisation such as St Vincent's or Calvary Mater. What they're putting it out there for is a not-for-profit such as Chris O'Brien Lifehouse. So we need to be careful here, because even though it's a not-for-profit, there's still 4 surpluses. So there's a different language, but we still see the same issues that I mentioned before, where they try to cut the conditions of our doctors and other staff members to ensure, for cutting cost purposes, and that's going to have an effect on patient care. With Shellharbour, there's still been no announcement. But recently, the unions held a candlelight vigil, and one of the things that we saw coming up to the local council elections is we had bipartisan support from Liberals, Independents and the Labor candidates all coming down to sign a pledge to say that if they were elected, they would back Shellharbour remaining public, and that includes Port Kembla. And I think that's a strong indication, and even though Labor won, that's a strong indication that this is an issue that's transcending politics. This is an issue that is clearly just about policy and good, sound health policy to keep our hospitals public and to invest in the public health system, because we have one of the best public health systems in the world, and we need to keep it that way.
Exactly. Thank you. All right. So, lastly, mentioned that there's Maitland and Shellharbour, was it? Okay, and what's the difference between the two? You mentioned that there was something special about that.
Okay, so the key difference is that Shellharbour right now is still up, the expression of interest is still out there for a private operator.
Right.
And that could be Healthy Care or Ramsay Health or any number of other private hospital providers.
Okay.
Maitland has been, that was taken off, and they've re-put it out there for a not-for-profit organisation.
Okay,
So,
all right.
yeah.
Okay, so it's based on not-for-profit or total profit.
Yeah.
Okay.
So they use the language
Simplify
of
it, yes.
surpluses as opposed to profit.
Okay, all right, got you. All right, so what can ASMOF and its members, more importantly, do to help this campaign?
That's a great question. I think the key thing about our members and our doctors is that they're so respected amongst the community. Their voice is so powerful. And standing together and voicing their concerns, it really highlights, one, their ethical and moral obligation, which we believe they entered into the public health system for, was to look after the most vulnerable. And that's what we're seeing from our members. Their key message is that, well, we got into the provision of medicine, and even our president, Dr. Tony Sara, talks about this a lot, that he got into the provision of medicine not to feed the pockets of the private sector, but to help people. And I think that's the key thing. And it is something that resonates with the community. It's something that resonates with politicians. So what we would be saying to our members is to contact us, and we can facilitate, whether it's writing a collective letter to the minister, whether it's coming to the rallies, whether it's speaking at those rallies, attending community forums, or getting involved and engaging with your community, engaging with your patients, and talking about how great our public health system is, and keeping it that way.
Excellent. Thank you so much for your time, Damien.
No, okay.
Take care.